Hello, I'm going to be talking about a patient named Susan Bowers. This is a 55-year-old woman. She weighs 173 pounds. Her height is 64 inches, which does indicate that her BMI is around 29.7, which through height and weight and all the calculations would indicate that she is overweight. Susan was admitted to the ER due to symptoms of experiencing acute chest pain and shortness of breath. She was then sent to cardiac care and eventually taken in to have a cardiac catheterization procedure done, as well as a chest x-ray. During that time, Susan's health history of her past includes primary hypertension, hyperedemia, and also osteoarthritis in both her hands. Her vitals, when done, did show that her blood pressure was 140/80, her temperature was 98, and she had a BPM of 72 for her heart rate. And her lab results did end up showing that she had elevated levels of both troponin, which her levels were 0.75, and myoglobin, which were 118. Susan is now currently NPO after surgery due to doctor's orders after having the cardiac catheterization procedure, and was requesting that she would like something to drink. Unfortunately, because she is NPO, she is not allowed to currently have anything by mouth, whether it's liquid or food. She has no known allergies, but it is important to note that she is on a kosher diet due to religious reasons. For Susan's nutritional diagnosis, based on her past health history and BMI, I believe that she is experiencing a deficit regarding food and nutrition knowledge and should be prioritizing and working towards a heart-healthy diet. Although Susan has many cardiovascular health concerns and considered overweight, we still don't have enough information to determine her dietary intake, and as well as like exercise, what she eats, all of that stuff we haven't been able to discuss with her and get a good evaluation to really diagnose. But from the information, that is what overall a generalized statement of diagnosis would be. Further assessment and conversations with Susan will help better develop a understanding of her diet. This will be a great opportunity to educate Susan on what a heart-healthy diet looks like and discuss future goals. As for nutrition intervention, once there is no longer an NPO for Susan, we will be able to ease into a heart-healthy diet that also follows a kosher diet, which can be called a kosher cardiac diet. This will include lean kosher proteins like fish, beans, poultry, and lentils, low-fat kosher dairy, prioritizing healthy fats like olive oil, avocado, nuts. Those are great, but then really limiting the saturated and trans fats, making sure that we are prioritizing, focusing on watching the sodium levels and make sure they're not rising too much. Should be 1,500 to 2,000 calories a day and should not exceed. And then prioritizing high fiber, 25 to 30 grams. How to educate Susan. It's very important to learn the best ways to educate her through all what she's going through. Going over the heart-healthy choices and sources is a great way to start with her, and being able to allow maybe what she likes and maybe preferences mixed with, knowledge on what she can have. Just a good mix, and making her feel like she has kind of a say in it too really helps. Being aware about her sodium content with foods and labels is important. And then how to incorporate this diet with also being on a kosher diet. It can be really hard for people that religiously are following certain diets, but then something like this happens where they are like medically needed to be on a different diet, and how to mix both. I think you can definitely balance both between the religious and their cultural needs and respecting those so much, and then also giving great nutritional advice, just utilizing what they can and can't have and finding alternatives. And then talking to her why limiting high fat and sodium is important for this diet and her recovery. Some goals for Susan are going to be reduce sodium intake and keep it around 1,500 to 2,000 milligrams a day, and then increasing fruit and vegetable intake while lowering high fatty foods. Susan is Jewish and follows a kosher diet. This should be respected and understood when providing nutritional planning. It is important to provide individual care based on the patient's religious and cultural beliefs. The nutrition monitoring for this case includes advancing hopefully from an MPO to a kosher, safe, healthy diet, monitoring her blood pressure and making sure that is being regulated, understanding the importance of low sodium and saturated fats in this diet and why that will help so much with her recovery and getting healthy, and then the weight and fluid status.